Hello and welcome everyone. Dr. Mandel here with you. I hope you're having a pleasant day or night regardless of where you are. Welcome everyone. Today's topic is going to be a very special one because of the fact that the hundreds of thousands of people, as well as millions of people worldwide, as well as the many thousands of subscribers that I have neck-related conditions. The thousands of comments that I come across over time is just drastically high. So many people who are suffering with these many types of conditions, and hopefully today I'm going to be able to solve a lot of your problems. We are streaming live right now as notifications are going out. Hello, chatters. We are going to teach you how to overcome pain in the neck, cervical radiculitis, pinched nerve, facet syndrome. And let's get right through this real quick because I have a lot to be said and I don't want to bore anyone, but this is really important stuff and I'm going to kind of move for it as quick as I can. First thing I want to tell you is that this is a condition that stems from the nerves, one way or another, or the muscles. Now, I want you to understand that most people who have neck pain and go to the doctor, the neurologist, the physiatrist, the orthopedist, their medical doctor, the chiropractor, the massage therapist, the physical therapist, right away when you start complaining of pain is go take the MRI. So what do we do? We get all panicky. We start getting nervous. We start getting anxiety. Oh my God, what if something shows in my MRI? I'm going to need surgery. I'm not going to be able to have my trip with my kids, or I'm not going to be able to go out with my wife or my boyfriend, or my whole life is going to stop. We go through anxiety. So the first thing I'm going to tell you is don't panic. I honestly mean that. Because the worst thing we can do when we try to get well is panic. Anxiety kills us. It makes the heart race, it increases adrenaline, it increases cortisol. It causes muscle contracture, it intensifies the pain. It releases catecholamines from the brain, doesn't induce enkephalins and endorphins, which are the natural opiates and painkillers. It just makes everything crazy. And that's the worst thing we can do. First of all, when we have any kind of problem, any pain, I say to you in a very calm voice, don't panic, because you'll get through it. Understand that this amount of people, this small percentage of people ever need surgery. But I can tell you the majority of people who get surgery are people that are told they need surgery that really don't need it most of the time. I can tell you in all the years I practice, and I wish all you people that listen to this video can sit in my office and watch the hundreds and hundreds of people that have walked through my door, thousands of people over the years, and I can tell you that very few of them ever needed anything significantly done of any invasive procedure. And I've seen the worst of the herniated discs, extruded discs, sequestered discs, because the body is a self-healing organism. And if you can sit this out, the body can do remarkable things. Now, I'll talk about that in another program. Let's get right through this because I have a tendency to talk too much, and this is really important stuff. Here's a pinched nerve. This nerve is being inflamed and irritated by many things. And you're saying, well, what is causing my pain? I just want to let you know, see my video on MRIs. Meaning that the MRIs don't panic, because most people who see MRIs look at the findings, and those findings of the MRIs do not correlate to the subjective and objective findings of what the patient complains of. So that means that even though you may have a herniated disc, because there are millions of people out there who have herniated discs that don't know it. And there are people who take MRIs that don't have herniated discs, they're in a lot of pain. So we try to come with a foundation of an answer that there is no one answer for all, but I'm going to explain to you that a lot of the conditions that you're having or the pain that you're having is not coming from your herniated disc or even a pinched nerve. You're saying, how is that? Well, let me show you. So as you see here, you have nerves that come off the lower cervical spine, brachial plexus, makes its way down. If you have inflammation on the left is a disc herniation. And yes, disc herniations can inflame nerves. It can cause pain on the nerves, but disc herniations in many conditions resolve. It may not totally resolve where it heals, where it looks perfect, but the inflammation is off the nerve. The body has remarkable capabilities of doing so if you aid it correctly. And the number one reason why people don't get well with neck problems is poor posture, forward head posture. Repetitive postural changes or things that you do repetitively that aren't changed. Okay? It could be occupation. It could be the work, the computer, your posture around the house. Those things that need to be worked on are the things that will help these conditions, along with some other, which I'll explain in a few minutes. Okay, so we have cervical disc herniation. You can see to the left, the C5, C6 bulge could affect the C6 nerve root. And I'll explain to you where these nerves go and how you can determine when you look at your arm or feel your arm or your shoulder or in your shoulder blade or a certain area of your body, where or what nerve is involved. And the reason why I want to teach you this is because if you can objectively pinpoint a nerve, which I'll explain in just a second. See this C6 nerve? I don't want to jump the gun too fast, but the C6 nerve can affect the biceps. In other words, if you're having tingling over here, this little finger, this is not your C6 nerve. So I want to teach you what the anatomy is and how it works, the neurology, so you can understand that, because when you go to the doctor and you're saying, well, I have tingling and burning here, and the MRI shows an MRI to a different level, that level is not controlling this. So you don't want to do anything to that level invasively because you're not going to get better. That's what I'm talking about. That's what is the most important thing, is you understand your body as good as I understand your body. Okay, so this is one of the most, when I say most, a very common condition, scalenus syndrome, thoracic outlet syndrome, but not after it comes out of the brachial plexus, right where it comes out in the anterior and the medial scalenus muscles. Now you think about poor posture, forward head posture, you think about stress, you think about occupational stresses, cumulative trauma dysfunction, cumulative trauma disorders, and just the muscle contraction can cause compression, irritation on the nerve. So that's why I'm very big. I love massage therapists. I have several that work in our office because they can release contracted muscles. They can stretch it. They can break myofascial changes. They can reduce scar tissue. They can reduce adhesions. And anyone out there who has not seen a massage therapist, who's seen a neurologist, a physiatrist, a medical doctor, a neurosurgeon, go find a good massage therapist. Because when you break down those adhesions, and you may be saying, I can only move my neck about so far, but when those adhesions are released, guess what? I can move my neck totally the way I'm supposed to be moving. Because if you notice when you're driving, you may be turning your whole body because you can't move your neck, even if there's no pain. So I want you to understand muscles play lots of funny games, and they compress nerves. And when those nerves become compressed, it is painful, and they can cause radiation of different areas. So that's very important. Dermatomes. If you look at this right here, this shows you the nerve roots, what areas they control. So in other words, the fifth nerve root will control this area in my arm. I know it's kind of hard to see, but you can see the sixth nerve root goes all the way down to the first two fingers. So in other words, if you've got a herniated disc, C5, C6, you're affecting the C6 nerve root, but you're affecting the little finger, which is a C8, and a neurosurgeon says, well, we better go correct and fix that herniation. That herniation is not causing your problem. You with me? That is probably one of the best educational tools that you'll get from this video, is that you can look to see the nerve root. So when they say an MRI or an X-ray that you got DJD or degenerative joint disease, and you got a fourth or fifth nerve root, but you're getting something over here, they don't work together. The puzzle doesn't fit. So if the puzzle doesn't fit, that's security for you. Don't do it. Don't do anything. Okay? And I'll get to that in a second. But there's three things I want to mention about herniated disc, or about pinched nerves, or about anything, pain, of surgery. 1, is the reflex gone? 2, is the motor strength that you have weakening? Or 3, is the area atrophying, or the bicep or the tricep, the muscle, is it getting smaller and smaller and smaller? One of those threes, or all or 2 or 3 of those, are indications that maybe you need more of an invasive procedure. But most people don't have that. And even if you have some atrophy or loss of muscle, by rehabbing it and allowing the body to recoup, that muscle will grow most of the time again. That's what I want you to that's what I want to educate you. Don't cheat. Don't give up. Don't put your head down. It's your body. And once you're cut, you're cut. Once whatever happens after that is in God's hands. So if it's not 100% medically necessary, which most of the time it's not, don't rush into anything. There's a lot of different things you can do for the body to repair and heal. Referred pain just shows you that, people with facet problems. What are facet problems? Well, if you look at the back of the spine here, normal C-shaped curve. Yes, I know the majority of this world have a straightening of the neck. That's from poor posture, and there's many other reasons. Don't panic. I spoke to a young lady today, and she's saying, my neck is straight. What can I do to get my curve back? Well, your neck's been straight maybe for 30 years or 10 years. You start monkeying around with the body and start forcing something that Mother Nature accommodated or compensated a certain way, you're looking for potential problems. My best answer for you is sustain what you have. Keep the good posture. Work on the postural exercises. Check out my videos. I have hundreds, many. Okay? Don't try to be a hero. Don't let the educated intelligence overtake the innate intelligence. The innate intelligence knows how to heal. Man, doctors don't know how to heal. Their job is to help the body heal. That's the way it should be done. These are facet joints in the back. And when these facet joints become arthritic or they become inflamed, you can then get referred pain to these areas. That shows you the level. So a lot of people will get burning in the upper trap or below in the scapula area. That can just give you a general idea of pain referred problems. Now, we spent a lot of time on these videos, SCM. See my SCM video, really good. A lot of people who are having pain, this is where it's coming from. SCM trigger points. In other words, they're saying, I got pain over my head, I got pain up in the face. You see those X's? If I turn my head like this, you see that big muscle stick out? That's my SCM, my sternocleidomastoid or sternocleidomastoid, however you want to call it. But when you start hitting these certain areas, okay, you're going to get referred pain in different areas. Okay, so when those areas become trigger points, because you may have a buildup of lactic acid in there, you may have problems within the vascular circulation to the area, and you start developing trigger points, you touch those trigger points, they can refer to different areas. And then once you start working those trigger points, the pain goes away. Here's another one, more from the trap area. You can see the referred pain in the area. Just want to bring it out to your attention. Here is another area. Well, I got pain down my arm. Well, guess what? The neurologist or the neurosurgeon or your chiropractor might say, take an MRI. Because, yeah, we know that nerves like this can come down the arm. Of course it can. But if I take your head and I bring your head back and I push down, or I bring it over and I push down, or I extend straight back, I'm compressing nerves. What I'm doing here is that I'm taking this nerve right here, this yellow nerve, and I'm compressing over that area to make it smaller, to make it more inflamed, to make it more irritated. So if you notice that you're moving your head back and the pain doesn't get worse, aha, trigger points, muscle contraction. That's the way the body works, because I or you should be able to induce the pain. Okay, there's a femoral compression test. If you take your head over the area and push down, okay, you narrow that channel where that nerve's coming out of, called the intervertebral foramen. If you narrow it and it doesn't increase the pain, it's not coming from that nerve most of the time. Okay, so you need to understand that a lot of the pain can be coming from muscle spasm, trigger points, facet arthritis. Let's come up here. We're almost done. Here's a trigger point there. But when you have points in a certain area, when you got that noxious substance of acid buildup, lactic acid, and you got something that's maybe overworked or a muscle that's overworked, you develop trigger points, you can get radiation of pain to a different area. Think about it. If you're having heart problems, it's a muscle, and you're getting pain in your left arm, guess what? That's referred pain. You understand that? So you could have pain, you have a problem here and get pain in the jaw. It's not coming from the jaw. It may not come from the jaw. You could have problems in the jaw and get referred pain back to the neck. All right? So this is what I want you to understand. I need you to look at this thing multidimensional. I need to look at this thing and look at it as like a whole puzzle. It's not like pain here, so problem here. It's not like pain here, problem here. You need to make sure where it's stemming from, where it's coming from, and this is what good medicine, good diagnosticians, and you need to become a diagnostician somewhat, even though I know you didn't go to medical school, but you need to understand your body, because if someone's going to do an invasive procedure on you, like an epidural, or they're going to want to do steroids, or they're going to go ahead and do something like ablation therapy, or a discectomy, or a laminectomy, last resort. You better try everything and anything before you let anyone touch you. This is just a chart here showing you the nerve roots, what they affect. For example, the C5 is my deltoid. Okay, so if I check the deltoid on you and I tell you to resist it, and I push down and I'm pushing, and all of a sudden you can't hold it, that's C5 weakness. So I can relate that C5 right back to your disc. Okay, if I check your bicep, all right, like this, I said resist, you can't hold it, it's really weak. I compare both sides, that's C6 nerve root. So we can put the puzzle together and say, okay, that C6 nerve root that the MRI showed a C6, and you're having weakness in here, and your reflexes are weak, yes, we have a complete diagnosis. We know it's possibly coming from a disc from that nerve, okay? But if you're not having motor weakness, even though you have a disc herniation, where most people do not have motor weakness, most people do not have motor weakness with disc herniations, the majority. So we want you to understand what's happening. Now, tricep, back here, you know, when you do these, push them up, okay, or you push down like this, you know, doing your tricep exercises. Your tricep exercise is C7. So if your tricep muscles are completely strong, but you have a C7 irritation or a herniation around that area, but your muscles are intact, that's good. So what we want to do is I want you to understand that you need to understand these muscles, that they're fine. You're not having atrophy. The reflexes are normal. You're not surgical. Okay? That's why I said to you before, what did I say to you before we started the program? Huh? Okay, tell me what I said. I said, don't panic. The worst thing we can do is panic. If you just tune in with us, we don't want you to panic. I want you to become educated. I want you to become your best patient. Okay? Because no doctor is going to care more about you than yourself. No doctor is going to knock at your door and say, Miss Jones, I was thinking about you all last night. I woke up in the middle of my night, my sleep. I just want to see how you're doing. They're not going to do those kind of things. Doctors are busy. Okay? They're doing their own thing. If it's their mother or their family member, yeah, maybe they'll do that. But they're not going to do that for strangers. It doesn't work that way. Okay, so here I want to show you cervical disc degeneration. Cervical disc degeneration, when the disc degenerates, gets thinner. People are saying, well, you know, stem cell therapy, you can fix the discs, you can fix the degeneration. Can you fix a bald tire? Can't do it. I will tell you, and I'm not trying to get hopes down on people out there, but understand you can't afford to wear things out in your body. You just can't afford it. You know, you can put substitutes in your teeth, you can maybe do other things, but when it comes down to discs, you need to take care of them, because when they degenerate, they're thin, they lose fluid, they're dehydrated. The annular fibers are worn and torn, like the outside that fray around a golf ball. The body just doesn't thicken and make it thick again. So I don't know where people get their news from, but you may be hearing it from other doctors on YouTube, but I can tell you, yeah, the body can do remarkable things. The body can repair herniations. The body can repair bulges. But when it comes to desiccation, okay, it's not going to get thick like a thick marshmallow again. So you need to take care of it. Now, here's the other thing I want to mention. That's a bone spur. Can bone spurs reabsorb? Yeah. Can narrowing of disc get real thick again? If they can, you're not going to see many. I'll never say never, because I don't know everything. Okay? I only know what I've seen. Okay, so what's happening in that disc, if you look at it, it's thin. And when it's thin, the space where the nerve comes out becomes smaller. So what happens is everything gets closer together, so that nerve is potentially becoming more involved and irritated. Okay? And disc degeneration and osteoarthritis and spurs all stem from one primary thing right here. Poor posture. poor posture, weight of the head being 12 pounds. Every inch you go forward is an additional 10 pounds. This just shows you 2 inches forward would be 32 pounds of stress, 3 inches forward, 42 pounds of stress, and more than that, it goes up to 60, 70, 80 pounds. The head is weight. And if you just do this all day, and the worst of the worst of the worst are the children, the young adults, because of the smartphone. It's ruining people. It's destructing people. If you're watching this today, come back to this video 5 years from now. You're going to see how many comments are going to be there, because there are so many people that's ruining themselves today that you're seeing young kids, 18 years old, 19 years old, with dowager's hunching. God, I wish I could just pull up my phone and show you some pictures. It's heart-wrenching when the mothers send me the pictures of their daughter or their children, young children, that look like they have 40-year-old spines. They're 12 years old, 15 years old from doing this. So please be smart about your children and everything else. Get that phone, that iPad up. Tuck that chin in. Do these chin tucks. Okay, just like this, like chin tucks. You can look at my channel. I got so much there to share with you. This is all about education. And this is going to be the epidemic. Not the influenza. This is going to be worse than the influenza. I hate to tell you that, but it will. Why? You got Samsung, you got Apple, you got Nokia, you got all these huge multi-million-dollar companies selling you all this innovative computer technology. The technology is ruining people's health. I hope that you really take this seriously. And I hope there are producers out there. I hope that there are networks out there that see this video, because we really need to educate the people out there. It's so important. I hope that you enjoyed this video, and I really hope that this gives you a little insight. Now you're saying, well, what do I do? Well, I'm going to give you a few tips. When you have degeneration, number one, posture. Inflammation, ice is always good. Moist heat is good. I even like infrared. You can get infrared therapy, $20, $30 on Amazon. Infrared therapy is light therapy, great for degeneration, great for arthritis, great for bursitis. If it's tendonitis in the shoulder, bursitis in the shoulder, in the elbow, carpal tunnel syndrome, it's real good. Moist heat is very good. Moist heat penetrates more. Cervical over-the-door traction, see my video on that. Serrapeptase, a great enzyme right here. Okay, I'm not trying to sell this to anyone. This is what I use right here. I'll put it in front of the camera. Okay, there's different ones. I take 120,000 SPU once or twice a day. This eats up the scar tissue. I have disc herniations. I've had issues in the past, and the reason why not too many people know more than me, because I had to do my homework. I've been to neurosurgeons in the past. I've had brachial plexus involvement in the past. Okay, but I'm strong, and I'm a perseverer, and people who follow me, you're going to be strong too. Because there's nothing more important to never underestimate the power of what the body can do, but you have to help it. You can't take a Bible and you cannot go ahead and start praying and say, okay, please get me well. You got to take action. You got to be proactive. You come out there and look at my videos. You come out there and go ask questions. You go out and look at other information. You read through the internet. You start doing smart things. So getting back to serrapeptase, see my video. Actually, I'll post it below on serrapeptase. You should look at that. I'll post it below. Turmeric, excellent anti-inflammatory. Quercetin, excellent. Ginger, excellent. Boswellia with frankincense, excellent. Apple cider vinegar, great for spurs. Cleansing the body, detoxifying. Great for even acid reflux. People say, well, why put that in my system if I already have acid? It works. But the key thing right now is that when it comes down to healing, one of the greatest things I can tell you is one thing. Cut the sugar out. You can go to the best doctors, eat the best foods, But if you're eating lots of sugar, you're having a lot of inflammation. You got to cut the inflammation down. When you start cutting the sugar down, I'm not telling you not to eat sugar, but cut it down. When you start cutting the sugar down, you are going to really see miracles of healing. Okay? There's no magic when it comes to healing. You just have to allow the body to be in the right environment. And when you have sugar, it's acidic, and that acidity causes inflammation, and that inflammation affects all the cells in your body. That's really important. I've done videos on sugars, and I really need to do more because I need to kind of brainwash people that, that it's not only causing, diabetes and heart disease and cardiovascular and all other kinds of conditions, but understand when our body becomes acidic, we got bacteria, viruses. They're more prone to overwhelm our system, our immune system. But when we become more alkaline, we have a lot more resistance. We have a lot more to fight. We have a lot less inflammation. And understand, before I just make way, there's nothing better than having an alkaline environment in your body. It will help you heal. I promise you. Many blessings to all of you. I really hope that this video does you well. I ask you to please subscribe to my channel. I hope that you will benefit so you can get further notifications in the future. Check me out, Motivational Doc, on Facebook. I appreciate any reviews that you can leave me over there. You can ask questions over there as well. Leave your comments below. There are going to be hundreds of people that will probably respond to this. This is a huge topic and commonly overseen worldwide, particularly out in Asia, in Africa, and throughout many parts of the world, Iran, Iraq. They just don't have the type of medicine, and there are people out there who don't have money and finances. So the purpose of these videos is to help as many millions of people as we can. I ask you to share this on social media. That's all I can say. Blessings to everyone, and may God continue to bless you and stay well in good health, and continue to stay proactive, and we'll see you next time. Bye-bye now.